Hi, my name is Marc Yates, Director of Emerging Markets at the Research Partnership. The patient really is an important stakeholder in emerging markets for two reasons. Number one, essentially this is a self-pay market, so patients have to pay out of their own pocket for treatment costs or the costs of prescriptions. In Russia, 60% of the cost of prescriptions are borne by the patient themselves. The second reason is that although private health insurance is growing at a rapid rate, still the penetration is relatively low. So patients have to pay for the best medications. So if they want branded, innovative medicines, they've got to either pay themselves or pay with their family members. The impact of the high out-of-pocket costs to the patient has a significant impact on the whole journey. So I'll give you a few examples. Number one, when the physician actually writes the script, then it's up to the patient to decide whether or not to actually fulfill that script. The second point I would make is that the physicians in emerging markets can have incredibly high workloads, and this leaves little time for the physician to actually educate the patients. And in many cases, the physician is the most trusted source of information. So if the physician cannot educate the patient, then the patient doesn't really understand the benefits of, complete adherence. Finally, because of this lack of information via the physician, we see proxies such as friends and family gathering information and giving it to the patient themselves. This high cost of out-of-pocket payment to patients really has a significant effect on preventative medicine. Let's start with vaccines. So in many markets, adult vaccination is paid for out of the pocket by the patient. If the patient perceives themselves to be at low risk, or that disease lacks relevance to that individual, then they're less willing to pay for the vaccine. One more example would be from Latin America, where broadly a lot of patients have a fatalistic view and they live day to day, so they don't plan ahead too much, and this translates into a lack of preventative medicine. So it is about costs, but it is also, it's stopping you presenting early on. And if it's an asymptomatic disease, then you won't necessarily go to the doctor because there's a lot of time and money involved to actually seek medical treatment. I think this means to pharma market research is that the patient is a critical stakeholder in the whole journey. They're the one true constant. Also, when we're looking at the patient journey, I think it's important to consider caregivers, especially for frail or pediatric or end-stage patients. So we can talk to caregivers to understand the patient journey because they are true proxies. So to understand the patient journey, I think we've proved that the patient is a critical stakeholder. We need to understand their attitude to the disease, their understanding of the treatment, and their willingness to pay for treatments.